Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, one on one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners with exam success internationally. Now, y'all know I always go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. And a little side note, y'all want to make sure that you have your notifications on. Make sure you have subscribed if you have not. If you're on my email list, all the things that you can get access, or make sure that you're following on all platforms. Because as the holidays are approaching, I promise you I have some up and coming things. So if you've been wanting to get any of my courses, my review book, my worksheets, and some other fun little study things that I have in store for you guys to make it a bit easier, if you've been wanting any of those things or to book a session with me, I have some things coming out and you don't want to miss it. So y'all better make sure that y'all are on the list. Don't say I didn't tell you. All right, so question number one. A 68-year-old male patient with a 20-pack year smoking history is diagnosed with stage 1 COPD. He experiences occasional shortness of breath with exertion but has no history of exacerbations. His spirometry shows a FEV1 of 82%. How should the nurse practitioner treat? Is it A, start a SABA as needed, B, initiate a LABA and a ICS combination therapy, C, begin oxygen therapy and consider surgery, or D, prescribe a long-acting muscarinic agent, a LAMA? Take a moment and tell me what you got. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here, the stem of the question states, how should the nurse practitioner treat? Remember, I always say, if they're asking for a treatment, run it back and see if they provided you with a diagnosis. And if they have not, you need to run it back a step further and look at those assessment findings so that you're able to determine a diagnosis, right? So here they told us it's a stage 1 COPD. Remember on yesterday's video, if you have not looked at it, go check it out. But we talked about the different stages of COPD, how to identify which stage they're in. So now that you know how to identify, you need to know how to treat those stages. So once you know what stage they're in, you need to know how to treat the stage that they're in, right? So if they are in stage 1, what are we doing for those patients, right? And the best answer is A, we want to start them on a SABA as needed, right? All right, question number 2. A 70-year-old female patient with moderate COPD, stage 2, has a history of a 40-year pack year smoking history and presents with increased dyspnea, chronic cough, and frequent exacerbation. She states that she is requiring her albuterol more often. Spirometry shows an FEV1 of 65%. How should the nurse practitioner treat? Is it A, with a SABA as needed, B, a LABA or LAMA, C, corticosteroids daily, or D, oral antibiotics for prophylaxis? Prophylaxis. Lord have mercy. Take a moment and tell me what you got, y'all. All right, STEM here states, how should the nurse practitioner treat? So, all right, we're going to run it back and see if a diagnosis has been provided. And it has. It's stage 2 COPD, right? So how are we treating in stage 2? The patient is needing her albuterol more, so we know that they're already on a SABA because albuterol is a SABA, so we don't need A. So now that we're in stage 2, we're going to want to add in that LABA, right? Yes, stage 2, you want to add in the long acting now. Also, so I always say to you guys, when we're doing COPD and treatment, you're going to go through the steps based off of stage 1, 2, 3, and 4. Stage one, we have that rescue inhaler. It could be a SABA or a SAMA, one of the short actings, PRN. And if it's flu season, you want to make sure that they get that flu vaccine, right? In stage two, like we're talking about here, we would have that short acting on board, either a SABA or SAMA. And then you're going to add in a long acting also, either a LABA or LAMA. And then also they will need to start with pulmonary rehab. I always say, remember that pulmonary rehab should be included in stage two. My Brittany's brilliance is pulmonary rehab is 2 words. Do it in stage two, right? All right. Now, question number three. A 75-year-old male patient with stage three COPD presents with severe dyspnea, frequent exacerbations, and limited physical activity. He has been using a SABA and LABA, but symptoms persist, and his FEV1 is 40%. He is considered for further management. How should the nurse practitioner treat? Is it A, start long term oral corticosteroids? B, add in an inhaled corticosteroid? C, initiate long term oxygen therapy? Or D, a SABA? Take a moment and tell me what you got. All right, so the similar question here asks, how should the nurse practitioner treat? So you know what to do. Run it back. Let's see if they gave us a diagnosis. And they have. This is stage three COPD. So now what are we doing? They're already on their SAB and the LABA, so we want to now add in an inhaled corticosteroid, which is B. So I was just telling you about stage one and stage two treatment. So stage one, we have a short acting, right? PRN, either SABA or SAMA. If it's flu season, we do the flu vaccine. In stage two, we do a SABA or SAMA still. We're going to always keep that on board, but now we need to add in a long acting, either a LABA or LAMA, right? And then they need to be a pulmonary rehab. Remember, stage two, pulmonary rehab is 2 words. Add that in. And if it's flu season, again, we're going to give them the flu vaccine. But now we're in stage three, right? So we have our short acting on board, our long acting on board. If it's flu season, we're giving them the flu vaccine. We already have pulmonary rehab on board. But now that we are in stage three, the Brittany's Brilliant says stage three, use the 3 letters ICS, inhaled corticosteroid. So you know to add that in stage three, okay? And then lastly is stage four. You have all of those on board, your short acting, your long acting, your ICS, your pulmonary rehab, a flu vaccine if it's flu season. And then now you'll want to add in oxygen therapy as needed. And then also, if warranted, they can result in needing surgical interventions. And that's further on down the line, and then nothing that we would do in our scope of practice. But just trying to show y'all how to step through the tiers, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you prefer to study independently, you can get the self-paced review that's also linked in the bio of this channel. It's designed for family and adult Gero. If you need any of the practice questions so that you can work through and apply and study, all of my QBank options are linked in the bio of this channel. And if you're looking to book a one-on-one session, as always, I say reach out by either calling, texting, or shooting us an email, as my one-on-one sessions. There's a variety of options, and I prefer to speak with you guys to gauge what you truly need to make sure you're booking the appropriate sessions. All right, you guys, as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.